It's a pleasure and an honor to be here and to be uh, giving the Jubilee Lecture for the 10th annual meeting today. Um, every lecture that we've had so far has been fantastic, and in many ways said a lot of the things that I was going to say. However, I think there's an opportunity to try to find some ways of bringing all of what we've been talking about today together, and that is what I hope to do and accomplish over the next hour or so, talking about neurotheology, a field of great importance, at least in my world, and I hope ultimately in yours as well. To think about the both the philosophical but ultimately the practical applications of this work in the context of healthcare, which I know almost every one of you is thinking about. The ways in which we engage spirituality in the context of our patients, our clients, even our own lives. These are very important questions for us. And I think, as you'll see, the idea of neurotheology as a field could be something that could be extremely helpful in helping us to understand these concepts and how they relate to ourselves and the people that we take care of. Oh, whoops, I'm hitting the wrong button there. Here we go. Now, in some sense, for this audience, I may not have to make this particular argument, but I frequently feel it is a good starting point. Question is, why are we studying this in the first place? And of course, all of you do have some understanding as to why we're doing that, because so many of our patients, so many of the people that we take care of in our lives have a religious or spiritual part of their lives, a dimension to their lives. And in fact, if we look at the research literature, we see thousands of articles that have been written about the relationship between spirituality, religion, and health. And of course, in the first several lectures that you've had today, you learned even more about the nature of religion and spirituality in the context of the brain, in the context of the heart, in the context of how we form our belief systems. So this is all very important information for us to begin to start to think about how we put all of this information together. And again, if ultimately there is this relationship, which I think almost all of us agree that there must be, um, how and why do these effects occur? What's going on within us? What's going on in our brain, in our body? How does this have implications for our overall health and well being? And these are some of the topics and questions that I hope to address tonight. Now, I think as we get into all of this, I'm going to try to break this down into a variety of different ideas and topics related to the larger topic of spirituality and health. And this has to do with various beliefs that we hold and how they help people to engage or think about their health and well-being. We're going to be spending a fair amount of time talking about various spiritual practices, like meditation and prayer, and how they have an impact on our mental health and our physical health. We'll talk about the good and the bad of religion and spirituality. And that's an important point that I don't know if it's been mentioned quite as much today, but certainly very fundamental in terms of how we think about engaging our patients when it comes to their own sense of religion and spirituality, helping them to understand how their religious and spiritual beliefs help themselves in terms of their coping, in terms of the physiological effects on their body, on their brain, as we'll be talking about. And we'll consider both the short term as well as the long term effects that these different beliefs and practices and experiences have on an individual person. And I will touch on to some degree a very important topic, which also has been addressed in the conference, which is how do we actually talk to our patients about these topics? What are the questions that we should ask? How do we do this in a way that's careful, that takes into consideration individual needs and belief systems? This is not something that exists certainly within the medical world very much. Probably, a little bit more, but still not enough in other fields of medical care, nursing, therapy, psychotherapy, and so forth. So we have to think a little bit about how all of this is ultimately translated into us as the healthcare professionals. Earlier today, you saw a couple of brain scans. I'm going to share with you some of the scans of our research studies. I decided to start with this one because, first of all, it doesn't look like anything you've seen so far, hopefully. But there is a brain in there, and and I think it's deeply relevant to the ideas about how various practices and experiences affect us and affect our brain, ultimately our mental states and even our physiological states. So the reason that this scan does not look like some of the other brain scans that you've seen and some of the other ones that you will see a little bit later on this evening is that it is focusing on neurotransmitters. And in this case, it is focusing on dopamine, which is looking at the top. Let's see if this works for me. Slow. There we go. What's doing down there? So the dopamine, which is this part of the scan, and serotonin areas, which are in this part of the scan. This is one of the first studies that was done looking not just at brain activity. You've seen things like the MRI scans, which are all extremely interesting and very helpful. Certainly, I've done studies with them. But this is one of the few studies that's ever been done looking at different neurotransmitters and how they relate to religion and spirituality. These scans came out of a study that we did of people who went through a spiritual retreat program that was actually based on the spiritual exercises of St. Ignatius. Some of you may be familiar with these exercises, but essentially, for the patients that came in through our study, they went through a 1 week program with a great deal of meditation, prayer, self-reflection. Now, this was specifically from a Christian-based perspective, and we fortunately have been able to study almost all of the major religious traditions, and I'm going to touch on some of them later. But in this case, it was looking at a more Christian-based spiritual retreat program. And what we did was we scanned them right before they went in for their week of immersive meditation, and we scanned them when they came out of their meditation program and of their spiritual retreat program. So if we look at the top scans here, this is what their brain looked like initially, and this is what their brain looked like after the retreat. And hopefully I can convince you that some of these areas look a little bit different. This area is much yellower, just a little bit of red compared to what you see over here. So these are areas that are in the very center of our brain. They're referred to as the basal ganglia, and these are areas that are very involved in dopamine processing. Dopamine, as many of you may know, is often referred to as the feel-good molecule. It's part of our brain's reward system. Makes us feel good. If we have a release of dopamine, then we feel elated, we feel happy, we feel joy. And this area is affected in many different diseases and disorders, including things like depression, Parkinson's disease are two of the more common ones. Now, what you're actually looking at in this scan is what's going on in what is referred to as the DAT, which is the dopamine transporter. What that does is it takes excess dopamine out of the synapse right after the neurons fire and talk to each other. The fact that there is less activity in this dopamine transporter after the retreat basically means that this person's brain is more sensitive to the effects of dopamine. So think about what that means for a moment. That means that the next time their brain releases dopamine, not only does it feel good, but it's going to feel extra good. So the fact that they went through this program seems to make their brain be able to feel extra good. And if you look down here, and I'm not sure how easy it is for everyone to really see this. There we go. It always appears somewhere. It's a little more subtle here, but this is a little darker green than what you see here. And they also became more sensitive to the effects of serotonin. When people are given medications for depression, they are given, the most common ones are the SSRIs, the selective serotonin reuptake inhibitor medications. And essentially, they do the same thing using the drug as what seems to be happening naturally by going through this spiritual retreat program. They make the brain more sensitive to serotonin. When you give an antidepressant, that hopefully brings the person out of their depression. But from the perspective of going through this particular retreat program, it also makes them feel uplifted. And this may help us to understand why, and if you remember from some of the slides from Dr. Lisa Miller, spirituality and religion protects people against depression. And these are also similar areas that are related to anxiety. So it makes a lot of sense that we can start to understand how engaging person's spirituality or religion may actually change their brain. This is not while they are meditating. This is before and after going through this program, and it has a profound effect on how their brain is working. And this ultimately connects back to some of the other things that you also have heard about tonight, earlier today, about the different networks in the brain and how different parts of the brain communicate with each other. They're using these different neurotransmitters as well as others. But this particular slide shows us that there could be some very fundamental changes that occur in the brain in response to religious and spiritual activities. Now, you also heard the term neurotheology in the introductory slide that I presented. And I'm not sure how many, hopefully, many of you have heard of the term, but if you haven't, my job tonight is to tell you a little bit more about it. So, the brief definition is that neurotheology refers to the field of study linking the neurosciences with religion and theology. However, there's some very important things I think you need to understand about neurotheology for it to work as a term. Certainly, I feel that this is important when I use the term neurotheology. The first important thing I want to mention is that it's not a neuroscientific study of theology. It's not only that, it's also not only a theological evaluation of neuroscience, but in many ways, it's really combination. It's bringing the two of them together to help us understand who we are as human beings. So I think that's important for us to realize that I'm not just talking about a purely materialistic perspective. I'm not just talking about a purely theological or spiritual perspective, but how we can start to understand both sides of that important coin, that we can understand who we are as human beings and the experiences and the feelings that we have. For neurotheology to be successful as a field, I think we also have to make sure that the science is kept as rigorous as possible. You've heard some wonderful studies from all of our presenters today, and it's exciting to see how some of the early work that we did, which was very limited and very preliminary, continues to be developed and advanced as we go through this of the whole process of learning what this relationship is all about. We also have to keep religion religious. Now, what I mean by that is that if I'm going to shove somebody into an MRI scanner and tell them to start doing prayer practice that they normally do in their mosque or their church or wherever they go to pray, I need to make sure that they're actually doing the practice the way it's supposed to be done, and they're having the feelings the way they normally do. If I put them into the MRI scanner and I tell them to pray, they're not able to pray the normal way, whatever that means for them. Well, then whatever I'm finding on the brain scan isn't very meaningful. So it's very important for me as the researcher to make sure that if I put whatever I'm asking them to do, that I have some idea that they've done it in a way that really preserves the religious or spiritual nature. Now, as I often like to say, I'm sure a lot of you have been in an MRI scanner. On one hand, it can be a pretty hard place to have a spiritual practice. It's a very difficult place to pray. On the other hand, for those of you who have been in an MRI scanner, you might find prayer to be particularly helpful at that particular moment in time. So, and I mean, interestingly, when we have asked the individuals, and we've scanned several hundred, probably 300 or 400 people over the years, most of them actually have pretty good experiences. I think they are very focused on trying to engage their tradition and their practice the way they normally do. So generally people say, yeah, that was actually a pretty intense experience for me. A couple of other important things I want to mention. One is that the neuro and the theology side need to be thought of very broadly. So the neuro side is not just neuroimaging, but it can be neuroscience, it could be neurology, it can be psychiatry, psychology, anthropology, all the consciousness studies, all the ways in which we get at what's going on in our mind and in our brain. And theology, of course, we've already had some conversations about theologians. Some of my best friends are theologians. And I think it's very important that while we can address the question about, well, what's going on in our brain when we think about a theological question, in order for neurotheology as a concept, as a field to work, we have to broaden what that means as well. So we need to think about spiritual practices like the spiritual retreat I just talked about, other types of practices, meditation, prayer, the different beliefs that people have, and of course, all the different experiences that people have that they refer to as religious or spiritual. So I think if we define both sides very broadly, neurotheology will work. And finally, I'd like to mention, and I think this is very important in the context of this conference, that it really ranges from very philosophical questions. We can ask questions about the nature of reality, the nature of free will, what happens when we have some type of revelatory experience, for example. What is the nature of good and evil? So, all kinds of very good philosophical questions to the deeply practical, the very practical questions about how do we take care of a patient who is dying and may want to pray or needs to have someone from their spiritual tradition or their community come in and have a prayer ceremony with them. These are very practical questions that we need to think about. And I think neurotheology can kind of go back and forth, which to me makes it very vibrant and very exciting. Now, this is really going to summarize how I'm planning on talking to you about this whole topic tonight, which is if we are going to think about the issues of studying neurotheology and health, we need to think about these five basic topics: definitions, targets, measurements, the clinical relationships, and ultimately the mechanisms, which are a lot of the brain scans that we'll be talking about. Now, about 15 years ago, I wrote a book called Principles of Neurotheology, and the very first principle was about definitions and coming up with good definitions. I know there was some excellent questions earlier today about, somebody asked one of the lecturers, well, what do you mean by spirituality, or what do you mean by religion? How do you understand these things? And that to me is absolutely fundamental to this entire conversation. And while we probably aren't going to have absolute definition that all of us will agree on, we do need to understand what each one of us means, or what the speaker means, when they say spirituality, religion, mind, spirit, soul, all of these different terms and many others. Very important for us to find ways of defining these terms. It's also to some degree important for us to define them in a way which makes them operational. And what I mean by that is that if I were to say, for example, define spirituality as the soul's connection to God, that may be a really good spiritual definition for that term of what spirituality is. But how do I get at that from a kind of psychological or biological perspective? I don't have a brain scan to measure somebody's, the soul's connection to God. That just doesn't exist. So we need to think about ways of operationally defining these terms. We want to be focused and narrow to some degree, but if we're too narrow, we might exclude things. I know we had some conversations about, I think a couple of people mentioned African religions. I'm actually working on with a colleague on some of the indigenous African religions and neurotheology as we speak. And so, if we were to say, a religion has to only believe in God and can't believe in ancestor worship, then what do we do with African religions? On the other hand, if we decide to define these terms very broadly, we might wind up including lots of things that shouldn't be included, or maybe they should be. Many times after I give a talk, People will come up to me and they will say, my spirituality is walking in nature. My spirituality is music. My spirituality is art and creativity. Is that appropriate for us to call spirituality? So, again, we have to think about how we want to define these different ideas. And we also have to think about all the different elements that could go into these definitions: our well being, psychological states or ideas, emotions, thoughts. And ultimately, if we put all of that together, we can develop some type of measurement tool to address what these definitions are trying to help us get at. The last thing I will say, because I thought I had this as one additional point, but the other thing that to me is very important about definitions is, where are they going to come from? If we have all of the theologians in the crowd come up with definitions for religion and spirituality, very different than the definitions that the group of nurses might have, or the group of doctors might have, or the group of sociologists or anthropologists. So we have to also find ways of bringing lots of different people together to help us with those definitions. And ultimately, I think these definitions will probably be dynamic, meaning that as we develop and acquire new information, we will likely adjust and adapt those definitions, much like when we were talking about our ways of trying to approximate the world and try to find ways of matching what we think on the inside with what people are feeling on the outside. So about 25 years ago now, I can't believe you had heard the mention of Dr. Harold Koenig. This is when I met Harold Koenig about 25 years ago at a conference where we were talking about spirituality and health. And it brought together about 80 scientists from around the United States to talk about what spirituality and health was. And we realized right off the bat that we need to come up with definitions for spirituality and religion. So I'm going to offer them to you right now. I'm not saying that they're certainly not necessarily the right definitions. I think they have value. They may not necessarily be the best definitions. There's some important aspects to these definitions that I think are helpful here. So they define the criteria for spirituality specifically as the subjective feelings, thoughts, experiences, and behaviors that arise from a search or quest for the sacred. They define search as referring to attempts to identify, articulate, maintain, or transform. And they define sacred fairly broadly, whatever the person felt was God, ultimate truth, whatever they felt was kind of the ultimate divine that they were connected to. Now, again, I think this particular definition has some value. It has the operational aspect to it because we're talking about feelings, thoughts, experiences. And I can ask you a question. What are you thinking when you believe in God? What are your thoughts about God? So there is some way that I can get a piece of these ideas. There's also a certain narrowness. They're talking about it as a search. Some of you may agree with that. I sometimes struggle with that particular point. The idea of something sacred, though, allows us to be broad. So it could be being in nature. It could be believing in God. It could be believing in ultimate consciousness of some kind. So again, I think this is helpful starting point, but certainly not the only kind of definition for us to begin to look at. They define the criteria for religion or religiousness as including the criteria for spirituality and or a search for non-sacred goals. Now, the and or is important because sometimes people have religion without spirituality, and sometimes they have it with spirituality. Many people who are religious will say they are also spiritual. There are people who will say, nope, I'm religious, but I'm not spiritual, as you heard in our prior lecture. The search for non sacred goals includes things like identity, belonging. Some of these are things that you heard in Lisa Miller's talk. Um, Typically, this is in the context of some type of spiritual criteria. And ultimately, what I think is perhaps the approach or the aspect of the definition I hear most often from the perspective of what a religion is that there's a group of people who say, this is what it means to be Catholic. This is what it means to be Jewish. This is what it means to be Muslim. and they define themselves based on that particular, the ideas that they have around that particular tradition. So again, I sort of throw this out to you. I would give you your homework assignment, which is go home tonight and take a piece of paper and write religion and spirituality and see how you might define these two particular terms. It's very important and it's helpful. Again, if you now have a conversation with someone about, maybe you're talking to uh, the president of your hospital and you want to bring more discussions about religion into the patients, and they don't like that, well, what do they think you're talking about? What do you think they're talking about? Very important for us to be on the same common ground. We may not agree. We need to know what each person is talking about. Now, this brings us to our targets. And these targets are a part of the research that I do. They're also part of clinical work that many of you may do. So, for example, when a patient comes into the hospital, what do they usually get asked? They get asked, "What are you?" And usually they'll say whatever religion they might be, or they might say, I'm nothing." But that really doesn't tell the story, right? If you have a person who says, "I'm Catholic," if you have a 50-year-old woman who comes in and says, "I'm Catholic," if maybe she was raised Catholic, born Catholic, raised Catholic, went to Catholic school, married someone who was Catholic, raised her children Catholic, and here she is in the hospital now with some issue, and she says, "I'm Catholic." Now, that's a very different Catholic than another 50-year-old Catholic who was born, maybe she was raised in a Presbyterian household. Maybe in college she dabbled in Buddhism and Hinduism, and she got into that. Then she thought, "Oh, none of this makes any sense," and became agnostic. And then maybe she married somebody who was Catholic about 5 or 10 years ago and decided she'd kind of re-engage her Catholic roots. Now, here they both come. They both say they're Catholic, but that's two completely different perspectives on what they are. So that becomes very important for us to realize. The other important point is how they actually, connect with their particular tradition. What are their beliefs that they have about that? And I'll touch on that in a moment. But it also has to another important question for us to deal with um, is how connected do they feel to their community versus how much do they feel that their religious beliefs are just part of themselves. They like to just do their own prayer practice. They'll open up the sacred text, the Bible, the Quran, and just take a look at what is important to them, but they don't necessarily engage in a community. Other people heavily engage in a community. Here you have somebody who now is coming into a hospital and they're no longer able to engage in a community because they're stuck in the hospital for a week, 2 weeks, whatever it is, while they're dealing with their cancer or their heart disease. For the person who has a strong communal aspect to their religion, this could be devastating. For the person who likes to just sit in their room and pray, it might not mean that much to them. It might not bother them that much. So again, very, very important for us to think about these questions. And of course, for me as the brain guy, I'm thinking, what's the difference in the brain between the person who is engaged in the social aspects of religion versus the individual aspects, for example? How much do people turn to their religious tradition for a sense of support, for a sense of coping? These are very important aspects of their religious beliefs, their spiritual beliefs. What are their beliefs and values? So often we tend to think if somebody says, "I'm Catholic," oh, I know what you believe. No, you need to ask them what they believe. And this to me is actually a really critical part of neurotheology, actually. And perhaps I should have said this a little earlier, but I really want to emphasize this point. To me, neurotheology is kind of a perspective to take where we ask questions. We don't just assume that somebody believes something because they say there's something. We don't just take for granted certain ideas, certain practices, certain beliefs. We ask questions. We constantly try to understand all of the nuances about religion and spirituality for an individual, for a group, for all of us as human beings. So when it comes to the beliefs and values that somebody has, what do they actually think and believe when they talk about their religious tradition. One of my favorite examples to tell people about is many years ago when I was a medical resident, we had a woman who had a lot of gastrointestinal bleeding. And we looked on her chart, and across the front of the chart, it said he was a Jehovah's Witness. So, for those of you who are not aware, that means that they can't take blood products. And that gets to be a very problematic situation if somebody's bleeding a lot. And she was bleeding badly. And I remember distinctly going into her room about 3 o'clock in the morning when her blood counts were getting very low. And I said to her, you know, I just wanted to talk about what's going on here. You're losing a lot of blood. And because you're a Jehovah's Witness, we can't give you any blood products. And she said, whoa. She said, wait a minute. So when I came into the hospital, they asked me what I was, and I said I was a Jehovah's Witness because that's what my mother was. But if I need blood products, give me blood products. So, and just, I mean, if I didn't have that conversation with her, she might have died because I just assumed that she believed based on what I thought her tradition was talking about. So we've got to ask those kinds of questions. We have to ask how committed they are, and ultimately the various practices and techniques and experiences that people have. And that's what we're going to be talking about a little bit later on. Now, how do we measure religiosity and spirituality? And again, I think all of you have had some aspect of how this might be done on a very practical level, on a clinical level. We ask questions. Again, this is what neurotheology asks us to do. Ask the question, what are you? What do you believe? How did you get to this belief system? So we want to ask those kinds of questions. And that's very important. Part of the problem is that those are very subjective measures. I have to rely on what you tell me. I have no way of looking at you. I have no religion mometer or whatever where I can tell how spiritual you are, how religious you are, how committed you are simply by looking at you. The only real objective measures that sometimes people can kind of come up with is how often people engage their tradition. And in the early work, certainly in the United States, which is a very heavily Christian population, a lot of the early questions that were asked were, how often do you go to church? With the presumption, not a bad presumption, that the more you go, probably the more religious you are. If you go to church every week, you're probably more religious than the person who just goes once a year. Not necessarily absolute, not a bad measure. But most of the other measures that we have are based on me asking questions. And there have been many questionnaires. There's a book that I often use called Measures of Religiosity that has about 125 different questionnaires in it. It's a wonderful book. It's about 25 years old, so it might be a little outdated, but there are questions about fear of death, about how people engage their religion, how they use their religion for coping, and so forth. So there can be self-report measures that can work. And I think psychiatry or psychology is the perfect model for this. Because again, I don't have a depression meter. I can't see how depressed somebody is in the audience simply by looking at them. I have to ask each one of you, how are you feeling today? How depressed are you today? And unless I do that, I don't know. But again, people can ask other related questions. How pessimistic are you about life? How often do you cry? How much are you sleeping? So there's other questions that we can also get at, and we can ask other questions about religious attitudes. For example, maybe I can ask you not just how much do you believe in your religion, but does your religious beliefs say something about the job that you will get, people you will marry, the person you will marry, the way you will raise your children, and so forth. If somebody says, I don't have to raise my children in the religion that I was brought up in, then they may not be as religious to somebody who says, no, I absolutely have to do that. So this is another important aspect of how we start to think about things, both clinically, but also in the research world. Because if I'm going to do a brain scan of somebody, I need to understand how religious or spiritual they are. Now, when we do look at various outcomes, now we're getting into the clinical outcomes. I'm just going to summarize this. Most of you probably know all of this, that for the most part, spirituality and religion, however you measure it, in this case, looking at things like church attendance, generally is associated with positive health outcomes. People have lower rates of heart disease, lower rates of high blood pressure, lower rates of lung disease, liver disease, suicide, as Dr. Lisa Miller talked about. It is protective of adolescents, of older people from depression, anxiety, suicide, and so forth. Specific diseases like heart disease, also, people tend to have lower rates of these diseases, and they do better with them. And many patients, particularly cancer patients, people who are dealing with really life threatening problems, turn to their religious or spiritual beliefs as a method of coping with the issues that they're facing. And when it comes to mortality itself, most studies have shown that there is reduced all cause mortality with more frequent engagement with religious practices, whether that is in the Christian tradition, other traditions. People, again, feel that they derive so much support from their religious and spiritual traditions that it actually has an overall benefit in terms of mortality for heart disease, for cancer. A couple of early studies showed that in the real old, the extreme elderly individuals, those people, for example, who are in nursing homes, may not be quite as clear a relationship. But I don't know if that's just because those individuals don't live long enough to be able to see those kinds of differences. The other issue, as I'll talk about in a moment, is that sometimes these individuals who are now taken out of their religious communities, for example, they may be struggling with their religious and spiritual beliefs. And that type of religious struggle can often be an issue that leads to increased mortality rather than decreased. And that does lead us to this issue about the negative health aspects. It's not all positive. For the most part, people do turn to religion to help them deal with the various issues that they face, and it can ultimately be beneficial, but sometimes things go wrong. And you heard that in some of the earlier presentations as well. But again, I think this is important from a neuroscientific point of view, from a neurotheological perspective. There's some really interesting questions for us to address that have not been addressed yet. And that has to do with questions about what's the difference in a person's brain, for example, who, when they are given the diagnosis of cancer, turns towards God, that God is going to help me through, versus someone who turns away, says, why would God have done this to me? Why is God punishing me? And of course, this leads into some of these negative health effects. If someone feels that God is punishing them and gave them cancer because of that, because of their bad behavior, their immoral behaviors earlier in life, or because they weren't spiritual enough, um, that individual may not be as eager to try to overcome their illness. They may not engage the therapies that are recommended to them. They may be pessimistic about their outcome. All of that can potentially lead to a worse overall outcome. People sometimes do go through a period of spiritual suffering or alienation. Maybe they are struggling with God or their religious traditions. I was always religious. Now I got cancer. Why did that happen to me? I lost my child. Why did that happen to me? And sometimes that can be very, very challenging and very difficult for people. Even when people have positive experiences, and maybe some of you have talked to patients who have had an incredible experience, maybe a near death experience, where they said, it was beautiful. I saw the light. I saw God. It was absolutely joyful and elating. But then they go and talk to their clergy person, their family, and they get some funny looks. Oh, yeah, that was just the medications that was doing that to you. That was just your brain, reeling through the near death process. And they're thinking, but this was so meaningful to me. This was so important to me. And so sometimes they can struggle with taking a positive experience back to either their community or even to their own belief systems. So again, as people try to figure out the realness of these experiences and what they mean, it can be a great deal. It can cause a great deal of anxiety or even depression. And again, from a brain related perspective, I often think about those individuals who pursue very unusual belief practices. Cults, for example, people who might be willing to kill themselves in the name of God, or kill themselves because they believe the aliens are coming in the comet or whatever it is that they have as part of their belief system. So these obviously can lead to very negative outcomes for the individual, for potentially society, if they're willing to kill other individuals. What leads a person down those paths? And perhaps can we use this information that we might be able to turn people into more positive directions as far as their own sense of themselves and their own sense of spirituality or religion? And along the lines of negative aspects of health, many individuals, many scholars have talked about the relationship between different mental disorders or neurological disorders and religiosity. And certainly, we know of many stories, some famous individuals who had temporal lobe epilepsy, who had unusual experiences, people who have schizophrenia. Why is it that when people have schizophrenia and they are delusional, they think that they are the Messiah? I myself have been visited by at least 7 people claiming to be the Messiah and wanting to scan their brain to somehow prove that. So, why is it that people go down those paths and they don't believe that they're, Stephen Jobs recreated or reincarnated? They always seem to go down a religious path. Why is that? And when people have bipolar disorder, they enter into manic phases. Sometimes they become hyper religious. When they become depressed, sometimes they can think, the entire world is evil. So there are some very interesting connections here. Sometimes I talk about neurotheology as being a very large jigsaw puzzle. And there are lots of pieces to that puzzle. And some of the different disorders as they relate to religious experiences can be part of that in terms of how we understand that relationship. Uh, Other things to think about are when people, the elderly, begin to develop Parkinson's disease, begin to develop Alzheimer's disease. How does that change their sense of religion or spirituality? And if they tell you that their sense of religion and spirituality is different, is that because they are actually experiencing it differently, or are they describing it differently? What's going on within them? And there's been some very interesting research beginning to look what happens as the brain begins to age, especially when it ages in very severe ways, such as Parkinson's disease or Alzheimer's disease. And of course, a lot of these aspects of the negative side of religion and spirituality have led people to say, well, if we're going to help people, we need to help people on multiple fronts. You heard in my introduction that I am in the Department of Integrative Medicine, and I believe it may have been uh, our first lecture today where there was a discussion about the different dimensions we are as individuals, that we are biological, psychological, social, and spiritual. And we certainly, in the integrative medicine world, adhere to that. And so therapies need to be directed to all those different dimensions. If you have somebody with depression, especially, you might need to treat them with an antidepressant, but perhaps they also are angry at God, or they feel that the universe is bad, or that God is bad. Perhaps they need to undergo some type of intervention that addresses some of their religious concerns as well. If I'm a medical doctor, I'm not comfortable dealing with those particular issues. Maybe they need to be connected to somebody in pastoral care, a clergy, who can help them try to address those issues as well. And when people have tried to find ways of integrating mindfulness, meditation, prayer, religious content into various psychotherapeutic interventions like cognitive behavioral therapy, these hybrid therapies have been shown to be very effective. But again, they need to be tailored specifically to the patient. As I like to tell people, I did a research study one time that showed that doing the rosary helps to reduce anxiety. It's a nice little ritual prayer practice, and it works. But I would not then go into Buddhist patient or Jewish patient and say, "Oh, here's the research that shows you should do the rosary because you're anxious." Doesn't make sense. They don't know what it is. So we need to make sure that the people who are getting these different therapies have the therapies that are appropriate for their religious and spiritual belief systems. Okay, so hopefully this has kind of summarized some of the previous lectures that we've had, but now I'm going to get a little bit more into the mechanisms, also now tying in some of what you already heard, but trying to address this a little bit also on the clinical side, the practical side. When it comes to why all of these relationships occur between religion or spirituality and our health, I like to divide the mechanisms into direct and indirect mechanisms. The indirect mechanisms, and I remember there was one question here earlier when there was a discussion about the study, there was a discussion about a study of nuns showing that they had, they tended to be healthier than a comparable group of individuals who were not nuns. They said, well, how many nuns have children? And maybe if it's having children or having families that is part of the stressors of life that the nuns didn't have to deal with. And that's a good point. The larger point is that there are many aspects of religious traditions that can have health effects. Most of them are positive, some of them could be negative. For example, most religious traditions will tell you not to engage in high risk behaviors. They tell you not to drink alcohol, maybe not at all, or maybe, minimally. They tell you not to smoke, not to do drugs, not to be promiscuous. Now, if I, as a doctor, went into all of my patients, I could get them to not drink, not smoke, not be promiscuous, and not uh, uh, do drugs, we would have a pretty healthy population. So they become healthy not because they are inherently religious, but because they are following various aspects of their religious tradition that ultimately might be healthful. For example, certain religious groups, like Hindus, may be vegetarian. And a lot of research in the integrative medicine world recently has shown that when people eat plant based diets, they are healthier. They have less inflammation, they have less cancer, they have less neurological conditions compared to the people who are eating a lot of the red meats and animal proteins. So, if individuals who are Hindu eat a vegetarian diet, they might ultimately be healthier than people who are Christian who are eating a lot of meat, but that's not because they're Hindu or Christian. It's because of the other practices that are part of their tradition. And ultimately, and this has been brought up too, is that social influences. Our brains are designed to be social. We have social areas of our brain that turn on when we connect with each other. That's why it's not so great when we were in COVID to have these kinds of meetings where everyone was remote because our brains just don't work as well as when we can be together and we can talk to each other, we can touch each other, we can say hello to each other, we can eat around the table together. And that social support has very positive outcomes in terms of our brain function and ultimately in terms of our health outcomes. Those individuals with cancer, with heart disease, when they have a strong social support network, they are likely to do much better. One other, just let me take one digression for a moment, that most of the data that I have been talking about on outcomes, on mortality, and so forth, that is population based data, right? So if we take 10,000 people who are religious and 10,000 people who are not, the 10,000 people who are religious are likely to do on average better. But that doesn't mean that there aren't going to be religious individuals who die young. It doesn't mean that you're going to have atheists who live to 104. But as a whole, these are the kinds of changes that we expect to see with individuals. Trying to understand those individual differences, that's where some of the more direct mechanisms come about when we start to think about the relationship between religion and our overall healthcare. So the direct mechanisms of action are some of the things that you also have heard about to some degree today. I'm going to talk about some of my own research in just a moment, but this has to do with the things that a person does as a religious or spiritual individual. So if one engages in a spiritual practice, things are changing. When you heard Renee talk about what's going on in your heart, the autonomic nervous system, the relaxation response, as Dr. Herbert Benson coined many years ago, where it leads to a lowering of heart rate and blood pressure. Again, as a doctor, if I can lower people's heart rate and blood pressure, I'm going to lower their risk for heart disease, for stroke, and I'm going to hopefully allow them to lead healthier lives. This is mediated by our brain. It's mediated by our adrenal cortex and so forth, the different organs and hormones in our body that also lead to alterations in how our heart is responding. Typically, this increases our heart rate variability. And you heard some discussion about that earlier today as well. This has important implications for our health and well being. So, if you, and I think somebody mentioned this analogy, but so many times when we talk about these spiritual practices, I think it's analogous to how we exercise a muscle, right? If you lift weights with a muscle, it becomes bigger, it becomes stronger, it can regulate itself better. And if our brain starts to do a practice like meditation or prayer, it's like exercise for the brain and it changes the way the brain operates. And we'll see the specifics of that in a moment. This can lead to changes in the brain's function, in our immune system function, in the inflammation that we have in our body. And of course, if we are able to do all of that, there are going to be very direct effects of these kinds of practices and the experiences that we have as a result of those practices on our health and well-being. So this led us to do a large survey study. The reason that we did this has to do with some of the things I said earlier. I mentioned that if I'm going to scan somebody's brain while they are praying, I need to ask them questions about their belief system. I need to ask them questions about what they're going to do during their prayer practice, what they are feeling, what they are experiencing. And that was all well and good for the couple of hundred people who I have already studied, but we wanted a larger sample size. So over a period of about 5 years, we did an online survey where we asked people to describe for us their most intense spiritual experience. We got about 2,000 people who responded to all of this, and we got all kinds of data about them. So we got demographic data. What is their religious belief system? What did they grow up with? What are they now? What is their psychological status? What is their physical health status? And ultimately, we asked them to provide a narrative of the experience. We gave them a box and we said, tell us about your experience. And from there, we could start to look at those, those emotions, thoughts, experiences that people have as the result of doing these practices and having these experiences, and try to get at that impact that these experiences have for people. When we looked at these narratives, and again, some of this should resonate with some of the earlier presentations that you had. Dr. Lisa Miller was talking about some of those core elements of these experiences. When we're talking about the impact on the heart, you heard about some of these things. So when we looked at all of these narratives, we could begin to break them down. Even though each narrative was unique, we could break the core elements of these experiences down to 5 key characteristics: a feeling of intensity, a sense of clarity, a sense of unity, a sense of surrender, and a sense of permanence. And there's different variations on these terms, as we'll talk about in a moment. But I want to give you a little bit more of an actual feel for what these specific core elements are and what parts of the brain seem to be involved in this. So here's a description of intensity. This is the description of intensity in the experience of a 43-year-old male. And he said this, he said, I, as an unnameable but individual being, was traveling down an infinite roller coaster, like waves of pure white ecstatic light. Ecstasy was overwhelming and rose and fell in intensity with the waves of light. The light path seemed infinitely long in both directions. The sense of the being and the light was infinitely more real than anything I had ever experienced. And those capital letters were from them, not me. So here you see many characteristics of an experience that is referred to in very intense forms: an infinite roller coaster, pure white ecstatic light, overwhelming, and infinitely more real. So, where in the brain might this sense of intensity come from? Well, in our brain scans, and over the years, I have tended to use a kind of scan called a SPECT scan, which stands for single photon emission computed tomography. What that means is that we inject a small amount of a radioactive material that goes to, as you saw on my very first scan, the dopamine areas of the brain, or on this scan, this measured blood flow in the brain. And that makes sense because the more you use a certain part of the brain, the more blood flow it gets. The less you use a part of the brain, the less blood flow it gets. And on this particular scan, this is basically a slice through the brain. So it's if I slice the brain this way, chop the head off, and now I'm looking at the brain. And let me see if I get my little button here. Okay. It's as if you're looking at the person lying down on the table. So the top part of the scan, this is the forehead or the frontal lobe. And you heard the frontal lobes mentioned a couple times. This is the back of the brain or the occipital lobe. And then, of course, you have the sides of the brain. And the colors represent the activity. So the red is more active than the yellow, blue, and the black. And as we talk about these scans, I also want you to understand that all of this is quantifiable. So when I talk about something turning on or whatever, there's statistical and quantifiable data that goes behind that as well. And these scans, you can do similar kinds of scans with MRI. So they all have their capabilities, they all have their strengths, and they all have their weaknesses. So where this arrow is pointing is a structure called the this is a set of structures called the limbic system. And most of you are probably familiar with this. This includes structures such as the amygdala and the hippocampus. These are areas of the brain that are very involved in our emotional processes. And so what we tend to find is that when a person engages a spiritual practice that delivers a very big emotional jolt to them, if you focus on where this arrow is, so this is the scan of the person when they're resting, but let's see what happens to that area when they go into their meditation practice. You can see that that area became much more active. It becomes much more red. I'll just go back here and again, just focusing on that area. So the limbic system turns on. And what we think that means is that it helps to tell them this is something that's important for you. This is something that's meaningful. It's something that's intense. The other important point to just take one step back, as you heard in some of the earlier lectures, is that all of these areas of the brain exist within networks that help the brain operates as a complete whole. So we can talk about areas that seem to focus on certain functions, which I'm going to do here to just help us understand it a little bit more, but also always understand that these are all areas of the brain that are part of larger networks that help with these larger processes that help us to feel emotions, that help us to focus attention, that help the brain work when it's not doing anything. So this is just another larger important point for us to realize. But again, this is one thing for us to realize in terms of the components of these experiences. Now, here is another description. This is a description of clarity in a 37-year-old female scientist. She said this. She said, everything in life seemed to click. I think Dr. Lisa Miller was talking about this sense of knowledge that people can have and that can arise from these kinds of experiences. He said, everything in life seemed to click. I had this clarity, and it was as if I was looking at life from the inside out. Despite my trepidation, this experience seemed to satisfy my proof-oriented mentality with the concept of intuition. It was almost as if my intuition from somewhere deeper had offered some sort of direct experience that offered up proof. Now, where would a sense of clarity? This does change us. And as you heard in the last lecture, as we talk about sort of our probability processing of trying to understand the world, how does our brain do that? And maybe there are different networks. One of the areas of the brain that we have found to be kind of interestingly involved in this is a central set of structures called the thalami. There's two of them, one on the left, one on the right. When we look at the thalami in individuals, we frequently see shifts of activity. So here is a person, again, at rest. And if you look at what's going on here, they're kind of equivalent in the activity. But when the person goes into their deep practice, their deep spiritual experience, you can see that there is a shift. One side now becomes more active than the other. Now, this is a very central structure, so it allows different parts of our brain to connect with each other, to bring sensory information up into our brain. So this may be very important in our predictive modeling, as you were talking about earlier. It may help us to get a sense of what is real and what may be changing as the result of having these experiences. I'm not saying that this is absolute, but this is one of the ideas that we have about areas of the brain that might be involved when people have these experiences. The sense of oneness, unity, connection, fundamental to these experiences. So here's just one example of this. This was a Hindu female scientist who was 45 years old. She said, during my meditation, tears were streaming down my cheeks when I experienced the feeling of oneness with all beings. My body felt very light. Rather, there was no separation between me and other external reality. There was no sense of self. So we have a subjective, powerful subjective experience. Again, very intense language being used. So that kind of goes with the other core elements. But the question is, where does this sense of self come from? And where does our sense of connectedness or oneness come from? Well, one of the areas that my colleagues and I have looked at for a long time, and you've heard this earlier today as well, is the parietal lobe. So now we're looking at the back part of the brain. This is an area that takes our sensory information and helps us to create spatial representation of ourself, how our self relates to the world. Objects in the world relate to each other. And so if you look at where the arrow is, you can see that in the resting condition, that there's kind of an equal amount of red activity all around the brain. When the person goes deep into their spiritual practice, watch what happens to this, what's going on in this arrow over here. So this part of the parietal lobe quiets down. It's almost all in yellows now compared to what you saw before. So if this is an area of our brain that kind of turns on when we are creating a kind of spatial sense of ourself, what happens when it turns off? Well, we would probably lose that sense of self. So this may be in part how our brain is able to interpret this experience of a loss of the sense of self, sense of oneness, a sense of connectedness. And this can occur in practices like meditation or prayer. It can occur in rituals where we feel connected to the group. There are many different times where this kind of experience may begin to occur. And we believe that these kinds of changes are what we would see. We've certainly seen it in a variety of different practices. The fourth component is the feeling of surrender. So here is a sense of surrender in the experience of a 48-year-old Christian woman. He said, I surrendered everything, including my faith and my salvation, and only for one reason. I loved God so much that I would truly give up everything to be connected with him. I said yes, and in an instant, God returned everything to me transformed. From that day forward, a new relationship exists between God and me. It is ever present, no distance, no separation. I am not attached to doctrine, dogmas, or rituals. I see God's actions all around me. Again, you see other parts of the core experience here too. A sense of oneness. There's no distance. God is ever present. But it was the sense of surrender that I found interesting in here. And this is a very common part of these experiences. The notion that the person is not making it happen. It is something that's happening to them. They are being pulled along. Different terms that people use. They surrender. They let go. They feel pulled along. And we see this again in a variety of different practices where a person specifically talks about the sense of surrender. This includes in our study of Islamic practices, where the basis of the tradition is the notion of surrender. And so when we've studied these kinds of practices, what happens in the brain of that individual? Well, you've heard a little bit about the frontal lobes. The frontal lobes turn on when we are focusing our attention on an object, when we are focusing even on a prayer, for example, when we are saying a prayer, our frontal lobes turn on. But what would happen if instead of being purposeful and kind of beginning to make that prayer happen, all of a sudden that all went away and it felt like we weren't doing it anymore? Well, if we look at the frontal lobes up in here, you can see right now in the baseline state, it's mostly kind of reds and yellows. But in in the prayer state, that area quiets down into mostly green. So again, I'll go back. You see kind of the blushes of red and so forth in here. And then all of a sudden, those areas begin to quiet down. So again, I think this makes so much sense that when a person surrenders to the experience, their frontal lobe actually kind of quiets down. But from a clinical perspective, this also has deep relevance because frontal lobes help to regulate a lot of our emotional responses. So if it might doing these kinds of practices might allow an individual to change their emotional set point, to change the way they focus on their beliefs and the way they regulate their overall brain and body. And that leads us ultimately to these kinds of permanent changes that occur. So when we ask people who did these practices what changed, we found that there were tremendous changes for these individuals, far and away for the better. So people no longer feared death. They felt their health was better, their sense of meaning and purpose in life was better, but certainly their sense of religiosity and spirituality seemed to be better. And this is not right after the experience. This was years after the experience. So there seems to be a transformative, permanent shift in these individuals, which leads to a whole different way of thinking about themselves. So, from a clinical perspective, helping people to understand what these practices and ultimately these experiences can do can be very helpful. Now, I do want to have you pay a little attention to the other side of this, which is that there is a small percentage of people where things, again, don't go well. The experience is not good for them. And we don't fully understand that. And this is something for the future of neurotheological research to look at, which is to try to understand what happens when these experiences go well, what happens when these experiences do not go well, and lead people into areas that make them feel worse in terms of their physical health, their mental health, and how can we maybe transform them into something more positive. The last point I want to make about some of our research and how it relates clinically, and this just kind of reinforces what we've already been talking about. Those last few brain scans that I was showing you were when the person was in the practice, when the person was having the experience. The first slide I showed you about dopamine and serotonin was a kind of pre and post. So that was a kind of a resting state scan of their brain. And therefore, we need to do the longitudinal. I think somebody mentioned that earlier. I think it might have been Renee, that we need to do the longitudinal studies, take people today and see how they change over time. We did some of the earliest work with that, taking non-meditators and studying them, giving them a meditation practice to do, and seeing how that changed their brain over time. Other studies, as Dr. Lisa Miller pointed out, looked at long-term practitioners, long-term believers in a tradition, how that related to people who were non-believers or were in other traditions. So these are the last set of scans that I want to show, which again are actually at 4 different time points. So these were all from one individual, and the A scan here, this is the initial resting scan. So this is just what kind of you're doing right now, just kind of taking in the world, not doing anything in particular. Then we taught them how to do the meditation practice. And in this case, it was a practice called Kirtan Kriya. It derives out of the Kundalini yoga tradition. It's a very simple mantra-based practice that they do for 12 minutes. And while they were doing their practice, we scanned them again. Then we had them do the practice for 12 minutes a day for 2 months and brought them back and scanned them at rest, and then scanned them one last time while they were in the meditation practice. So to me, the most important is the A and the C scan. This is the resting state of the brain. This is what their brain looked like initially, now what their brain is doing today after they had done the meditation for 2 months. And there are a couple of very important changes that we see. One of them is in our friend the thalamus. You can see that initially this individual had one side of the thalamus be a little bit more active than the other. But when they came back, there seemed to be a shift. And I don't know if you can see this all the way in the back, but this side may even be a little bit more active than here. And on the D scan during the practice, this side is certainly more active than here. So after 2 months of doing a practice 12 minutes a day, their thalamus activity has shifted. And if we look at the frontal lobe as well, we can see that if you look here, the frontal lobe itself is sort of more in the red activity than what you see at baseline. So the frontal lobe has become more active. And just like you heard from Dr. Lisa Miller, that this to me is a kind of training effect. And it goes back to my analogy of the muscle, that when you lift weights, your muscle becomes bigger and stronger, and your brain becomes literally bigger and stronger. So not on this study, but other people have found that long-term meditators have bigger frontal lobes. Their frontal lobes are thicker than non-meditators. And our study shows that they're more active. And this correlated with improvements in concentration. As I mentioned, the frontal lobe helps us with concentration, and it helped with emotional regulation. So they had less anxiety and they had less depression as a result of doing this practice. And the last point I will make about this particular study is that if we can cause changes in the brain doing a 12-minute a day practice for 2 months, imagine what's going on in the brain of a monk or a nun who's doing these practices for 5 hours, 6 hours a day for 30 years, and how that changes the way their brain operates and functions. So where does this lead us? Well, we've learned a lot, but there are many more questions than answers that we have at the moment. From a clinical perspective, we want to think about, what are we going to do with individual patients? What types of interventions do we want to bring, perhaps to help them deal with whatever issues they are facing, physical or mental health wise? Does it work? What's the clinical data? You've seen a lot of physiological data, but we need other studies. I mentioned our study of doing the rosary. There are a lot of studies of mindfulness practices. There are studies of loving kindness meditation that show that they seem to work and help people. But what we don't really have, this is something I have lamented for a long time. I hope someday to get the funds to do a study like this, is which practice do we use for a given person? If you have a 20-year-old college student who's stressed about taking their exams, what meditation practice works best for them compared to a 50-year-old divorcee who's stressed about the divorce, compared to an 80-year-old who's in a nursing home? We don't know. We don't have that information right now. And it ultimately turns to all of you to try to figure out the best way of individualizing the care for the patient. But it'd be great to have more data to help you in that process. What are the critical ingredients? This is a very important point as well. When it comes to religion and spirituality, as I always like to say, there isn't just one part of our brain that is religious. When we walk into a house of worship, there isn't one part of our brain that turns on, and then when we walk out, it shuts off. And for all of you who are religious or spiritual, I think you'll appreciate the idea that your religion sometimes evokes emotions, sometimes it evokes thoughts, it engages different sensory processes. So if there's a part of your brain that is your religious or spiritual part, it's the whole part of your brain. And the network theories that we know about these days also supports that. So what are the critical ingredients? Is it more important for a person who is dealing with cancer to engage the emotional side of their religious tradition, the cognitive side, the side that's involved in meaning and purpose, social side, all of it? We don't know. How do these various approaches interact with other health variables? So how do we help people manage their diet, their nutrition? This is why going into various houses of worship can be so helpful to do blood pressure testing, to do testing of hemoglobin A1C, because we can bring together the religious and spiritual aspects with the other health aspects that are important for a person. What are the targets of in terms of the populations that we should look at, and ultimately how are these changes measured? And finally, as I mentioned, more research is needed. We need to improve our understanding of the brain, of our mind, of our consciousness, of our soul, and we need to be able to address all of the questions that come about because of this, the very practical as well as the very philosophical. And that ultimately are some of the questions that I look forward to trying to find out about the true nature of reality, how we as human beings perceive that reality. And you are welcome to explore some of this. As was mentioned, a couple of our books are out there. Uh, how sexuality and spirituality, it's a whole other lecture, which we're not going to get into tonight, but the varieties of spiritual experiences, and then many different aspects. And part of what I'm very excited about is that we're starting to explore individual traditions. And I've done a book on Judaism, on Catholicism. As I mentioned, I'm working on a book now on African religions, on Islam. We're going to be working on future projects on Buddhism, Hinduism, and we hope to be able to get to all of the different traditions to talk about this relationship. So thank you very much, and I look forward to your questions.